be presenting my project titled Exploring Social and Economic Factors Associated with SNAP Participation and Food Insecurity Among Households in Hawaii. A little background on me, I am from Nech, Bombay in the Federated States of Micronesia, and I'm currently a rising senior at Chaminade University, and I study business administration with a minor in economics, and I also work as an undergrad researcher. And before SCIPE, most of my research experience involved was qualitative research, particularly food security among Native Hawaiian and Pacific Islander communities. And through those interviews, I repeatedly heard participants describe challenges related to food affordability, transportation, grocery prices, and access to culturally important foods. And those conversations made me ask an important question for myself. Could publicly available data explain some of these same patterns across Hawaii? So that curiosity became the foundation of this project. And in joining this program, I wanted to learn quantitative research methods, Python, and data science, so I could approach community issues from a completely different perspective. Moving on to my problem and research question, food insecurity is much more than simply not having enough food. I believe it reflects broader social and economic conditions that influence whether families can consistently access nutritious and affordable food. Factors such as income, employment, poverty, and where people live all contribute to food access. And because SNAP is one of the largest food assistance programs in the United States, I wanted to use SNAP participation as a measurable indicator of food assistance need. So my research question became, how are social and economic factors associated with SNAP participation and food insecurity among households in Hawaii? The data sources I used, I relied entirely on publicly available data sets. My primary source was the US Census Bureau American Community Survey. And from the ACS table B2203, I collected information on SNAP participation, poverty status, and household counts. And from the DP03, I selected economic characteristics table. I gathered information about employment, labor, forced participation, household income, and poverty indicators. I also used Hawaii's ACS profile data to better understand statewide demographic and economic characteristics. And to complement these census data sets, I incorporated the 2025 Food Insecurity Index from Hawaii Health Matters, which provides a more geographic measure of food insecurity across counties and the zip code regions. And together, all these data sets allowed me to examine both socioeconomic characteristics and geographic variation. Once I collected the data, I followed a 4-step workflow. First, I imported the data sets into Python. Next, I cleaned the data by organizing variable names, standardizing the tables and labels, checking formatting, and then I ensured that there was consistency across these data sets. And after cleaning, I conducted exploratory data analysis where I calculated the descriptive statistics, the participation rates, the comparisons between groups, and I also identified areas with higher food insecurity. And finally, I created the visualizations using Python to communicate these findings clearly. The primary libraries I used were Pandas for organizing and cleaning data and Matplotlib for creating graphs and visualizations. I was identifying patterns and associations, but not building predictive models or making causal claims. Before looking at individual findings, I wanted to summarize my key results. As you can see, across Hawaii, there are approximately 493,000 households, and about 56,700 households participated in SNAP, representing roughly 11.5% of all those households. And the statewide median household income was approximately $100,700. Even with a relatively high median income, SNAP participation remains substantial. And this immediately suggests that income alone doesn't fully explain food assistance needs, especially within Hawaii's unique cost of living environment. For my first finding, this graph compares households that received SNAP with those that did not. Approximately 56,690 households received the SNAP benefits, while over 436,000 households did not. And overall, about 1 in every 9 households participated in SNAP. Although the majority of those households were not enrolled in SNAP, this visualization demonstrates that food assistance remains an important support system for many families here in Hawaii. And for this project, the SNAP participation served as that measurable indicator of both the food assistance need rather than like a direct measure of food insecurity itself. Moving on to my second finding, this was the strongest relationship identified in my analysis. The graph on the left compares SNAP participation rates by poverty status. Approximately 41.9% of households below the poverty line participated in SNAP. In comparison, only about 8% of those households at or above the poverty line participated. And when comparing these rates, households below poverty were approximately 5.3 times more likely to participate in SNAP. And the graph on the right just shows the actual household counts behind those percentages. And yeah, together these figures, they both demonstrate a very strong association between poverty status and participation in food assistance programs. This slide provides additional socioeconomic context. The employment graph shows that most Hawaii residents are employed while unemployed remains relatively low. However, despite relatively strong employment and high statewide median household income, SNAP participation still remains present. This suggests that employment alone does not eliminate food assistance needs. The high housing costs, transportation expenses, and Hawaii's overall pressure on these households, even among those who are employed. For my last and final finding, my final quantitative finding focused on geography. The graph on the left compares average food insecurity index scores across Hawaii counties, and Hawaii County had the highest average score, followed by Maui County. And the graph on the right highlights the zip code regions with the highest food insecurity scores. And the highest index score was found in zip code 96778 within Hawaii County. And these findings, I do think that food insecurity is not evenly distributed throughout the state. Instead, geographic location also appears to contribute to the food insecurity that community food assistance needs. And this is the food insecurity index map. This map helps visualize those geographic differences. The darker green areas represent greater relative food insecurity according to the food insecurity index. It's also important to understand that this index ranks communities relative to one another rather than measuring exact household food insecurity. The purpose of including this map is to complement the statistical findings and demonstrate that food insecurity varies across places. Combining these statistical analysis with geographic visualization provides a more broader understanding of where that support may be most needed. Overall, 4 major themes emerged. First, poverty showed the strongest relationship with SNAP participation. Second, both the all high household income does not necessarily eliminate food assistance needs because Hawaii's cost of living creates additional financial pressures. Third, employment is important but does not fully explain food insecurity. And finally, geography also matters, as some communities consistently showed higher food insecurity scores. There are also some limitations. The aggregate for the census data, it's not really on, it's more a summary level census data rather than individual household information. This analysis is cross-sectional, representing one point in time, and the results describe associations rather than evidence of a cause and effect relationship. What I learned through SCIPE, I do believe that this summer challenged me in ways I didn't expect. I was much more comfortable conducting qualitative research than quantitative analysis. But throughout the program, I learned how to work with large public data sets, clean and organize data using Python, and performing exploratory data analysis and communicating these findings through visualizations. Also participating in the workshops that were introduced with Jetstream and COA, it really helped me better understand how advanced computing resources support like a larger scale scientific research. And I became much more confident working with quantitative data and learning how it can complement the qualitative research I've already been doing. In the future, I would like to expand this project by incorporating additional socioeconomic variables, including housing costs, education, disability status, and transportation. I would also like to analyze multiple years of data to identify changes over time. And as more detailed data becomes available, maybe my future studies could explore statistical models such as logistic regression to better understand the factors associated with SNAP participation. And finally, I hope to combine the quantitative findings like these with qualitative community research. I'd say my biggest lesson from this project is that food insecurity can't be explained by a single variable. Instead, it reflects a combination of poverty, income, employment, and geographic context. And although this project was exploratory, I hope it contributes to future conversations about data-informed approaches to improving food security. And finally, I would like to sincerely thank my mentors, Luke, Kaipuni, and Aftab for their guidance throughout this project. I'd also like to thank Dr. Alex, the entire SCIPE team, the University of Hawaii, and everyone else, especially Dr. Sean Cleveland. And thank you to the U.S. Census Bureau and Hawaii Health Matters for providing the public data used in this project. Thank you, and Galangan, I'd be happy to answer any questions.
Very nice, thank you. Great presentation. Does anyone have any questions? No questions. Okay, thank you very much.